Hello guys, hello family, hello friends. This is Dr. T and welcome to Clinical Medicine with Dr. T. So guys, in this video, I want us to talk about antihypertensives, specifically calcium channel blockers. So for the next couple of weeks, I'll be doing antihypertensives and focus on one class at a time. But in order for us to have a broader understanding, I'm gonna do a brief introduction of antihypertensives before I can actually focus on calcium channel blockers. So, as we know, the formula for BP is equals to cardiac output multiplied by the peripheral resistance. So this mathematical formula, it's showing us that if you manipulate cardiac output, you can either increase or decrease your BP, or if you manipulate your PR, which is your peripheral resistance, you can either increase or decrease your blood pressure. So we're talking about hypertension here. So hypertension is a chronic state of BP elevation, right? So cardiac output, we also need to break it down. Cardiac output is a product of stroke volume multiplied by the heart rate. So if you increase a patient's heart rate, you are going to increase their cardiac output and increase their BP according to this formula. And also, if you decrease a patient's heart rate, you will decrease their cardiac output and eventually decrease their blood pressure. The same thing applies when it comes to stroke volume. If you increase a patient's stroke volume, you will increase their cardiac output and eventually increase their blood pressure. Right? So all antihypertensives, they just manipulate this formula to control the BP. I want to repeat, all antihypertensives, they manipulate this formula, these variables, in order to decrease the blood pressure. So if we take it further down, we also understand that stroke volume is dependent on the preload. What is a preload? A preload is the amount of blood that makes it back to the heart from the inferior vena cava, basically. So the higher the preload, meaning the higher the amount of blood that makes it back to the heart as venous return, the higher your preload will be. And if you increase the patient's preload, their stroke volume will increase, their cardiac output will increase, and also their BP will also increase. So preload depends on the venous return. Venous return, right? And the venous return depends on the blood volume. The less blood you have in the system, the less venous return you will have, and the less preload you will have, the less stroke volume you will have, and eventually the less BP you will have, right? Okay. Also, another contributing factor to stroke volume is contractility. So the more forceful the cardiomyocytes are contracting, the more stroke volume you'll have, the more cardiac output you'll have, and the higher your BP will be, right? Okay. The last factor that contributes to stroke volume is afterload. Afterload. I promise you, if you follow, I mean, this is very, very basic and very, very simple. If you follow it, you'll never have problem understanding the mechanism of antihypertensives, all of them. Okay, so the afterload, if you increase a patient's afterload, you don't want, if you want to decrease a patient's blood pressure, you have to decrease the afterload, because what is afterload? Afterload is the work that the heart needs to do to overcome peripheral resistance in order to have a good cardiac output. So the higher the afterload, it means it's difficult. It's gonna be difficult for the heart to pump against that resistance, and you are gonna have a decreased stroke volume. So what you want to do in a hypertensive patient, you want to decrease the afterload, so that it becomes easier for the heart to actually pump. You don't want your heart to pump against resistance, especially if you've got heart failure. Okay, so this is what we understand. You can also, like I said earlier, that you can also decrease a patient's blood pressure by actually decreasing their heart rate, right? Okay. Now, let's talk about the class of drugs that are used or that are found that can sort of like manipulate or make changes in all these determining factors. So what are the drugs that can decrease a patient's blood volume? Those drugs are called diuretics. Diuretics, they decrease a patient's blood volume. That's why a patient is going to go and pee and pee and pee and pee. The more urine they produce, their blood volume is going to decrease, their venous return is going to decrease, meaning their preload will decrease, stroke volume will decrease, cardiac output will decrease, and eventually BP will also decrease, right? And we know that diuretics, the most common ones, there are two classes that we have. We have got what they call the loop diuretics and the thiazide diuretics. We are going to talk about this, but this is an introduction. What I want us to talk about is calcium channel blockers, but I want you guys to understand where do calcium channel blockers work, what is their target area, what is their target receptors, and how do they execute their function, what is the physiological basis of calcium channel blockers, right? Okay, so let's move on to contractility. The drugs that decrease contractility in order to decrease stroke volume and decrease cardiac output and eventually decrease BP, they are called calcium channel blockers. Some people call them calcium channel antagonists, right? Okay. Afterload, the drugs that we have there are your ACE inhibitors. ACE inhibitors are good vasodilators, including hydralazine. Right? The class of drugs that we can use to decrease a patient's heart rate in order to decrease their cardiac output and eventually decrease their BP are called beta blockers. And we know that we've got two types of beta blockers, selective and non-selective. Just like we are going to talk about the two types of, or the two classes of calcium channel blockers as well. So there are beta blockers that specifically target beta 1. Then there are those that target beta 1 and beta 2 receptors, right? Okay, now that we have this is what we want to talk about, calcium channel blockers. So I'm gonna clear this and then we zoom into calcium channel blockers. Thank you.